Hi folks, it's John Adamson, the Rehab and Documentation Guru. Today is the day after Christmas, 2019, and I am laboring today, as probably a lot of you are, because let's face it, in our current healthcare situation, not a lot of vacation time unless you've been with the company for a good while that can be afforded around the holidays, because we still have patients that need to be seen. I'm talking today about working your patients within their physiological limits, however that's determined. A lot of you who watch my channel I know are working with very medically complex patients. And so you've got to figure out a way, what is the limit this patient can work out to? What parameters can I look at to judge whether or not it is safe and effective to keep working them? Case in point, went to see a patient today. I've only seen her once before for a case opening. She is status post chemotherapy for her cancer, and she's got obviously a lot of residuals, which include, for example, peripheral neuropathy as a result of the chemo. She's also diabetic, but she says the diabetes did not cause the peripheral neuropathy. And she's got associated cardiovascular limitations from being on chemo for a while. So I went to see her today. She had a fall the other day. And she's significantly weaker. In fact, just walking 20 feet wipes her out. I didn't find that out until I started initiating some exercise with her. I took down the information about the fall. Was it preventable? That type of thing. Did a little education. Had her start to do a little bit of exercise, which she should have been able to tolerate based on my eval the other day. And it became clear she was wiping out very easily. I mean, just standing toe raises and a little bit of marching, and she needed to rest between each of those and barely got a few reps off. And then I tried a supine exercise, and that wiped her out. And I realized this lady is not tolerating this stuff at all. Her heart rate bump during this from rest to end was not significant and still considered within cardiopulmonary parameters. She also had a resting blood pressure that was fine. I didn't get a timely follow-up blood pressure. But her perceived exertion was definitely way off the chart. She was very dyspneic. She was just generally wiped out. She was unable to do a home program today. She was unable to participate in meaningful therapeutic exercise and activity. And so I told the daughter who was there to please contact the doctor about the possibility that maybe something's off on her labs. Post chemo, I mean, maybe she did have a previously low hemoglobin. She might be still low, and she doesn't remember getting anything to treat that. She might have been given something to boost her blood cell production, red blood cell production, but she's clearly wiped out. And of course, also, she could be having electrolyte issues, and she's got loose stools, so maybe she is putting off too much fluid. But she doesn't really show dehydration clinically. She's peeing fine, blood pressure is fine, urine normal color. So we've got to figure out ways to determine, is our patient physiologically capable of doing what we're demanding of them. And when you're working with medically complex patients, one of the things that shows your skill as a therapist is to drill down to that kind of stuff, determining their physiological capability, because a non-skilled person without a license would not pick up on these things that you should be able to, based on your knowledge and expertise of the patient's clinical diagnoses and their clinical presentation. Anyway, some just brief thoughts on physiological parameters, guidelines. Find what's limiting your patient, document it thoroughly and objectively, and then base your treatment on that, because that is skilled. Anyway, John Adamson, the Rehab and Documentation Guru, wishing you a wonderful day. Take care and God bless.